questions that you have about the community assessment centers.
So I want to say hello to everyone and welcome to the Nissan Stadium Assessment Center site. I'm happy to say that this morning we've had tested approximately 34 individuals, and we've had 9 that actually came and did not need to be tested. So I'm very happy to see that the numbers are low. That tells us that people are using the COVID-19 call center to determine if they even should come here. Also, people practicing the safer at home. We hope that this will help sort of level out the playing field for us to be able to at least control the spread of the COVID-19. So again, we welcome you to this center, to this assessment center. And as you know, we also have Meharry opened up as well. And we're doing these Monday, Wednesday, and Friday. So Wednesday we'll have not only Nissan Stadium and Meharry, but we will also have the center on Murfreesboro Road. So again, we thank you, and I will just allow this to be an open question, and for whoever wants to answer, we'll step up to the mic. So thank you.
So the question is, are we surprised by the number? Short answer is, I mean, all bets are on the table. I think what this shows to me is that our healthcare system has been working. As I've mentioned previously, over 4,000 tests have been conducted in the city. I think people are using a hotline. I think if you don't need to be assessed in person, then don't come here. And hopefully that system is working, because if you come here and you shouldn't be here, first of all, you may be exposing yourself, but secondly, you're clogging up the system. And so I'm just proud of the system that we've established. People have access free of charge to all Davidson County residents. The number of volunteers, everyone you see behind you are volunteers from the medical systems, the National General and Vanderbilt at this site, St. Thomas and HCA at our other site, and then Meharry on their independent site. And I think it is amazing, the volunteers. So we're ready to take what needs to happen, but gosh, if people don't need to use the system, that's great. But we want people, if they need to know that we're another resource to them in addition to what's out there.
How long does it take to get results back if you come to
So we send our results to a private lab that the state of Tennessee has arranged for us. That's how we're able to do this at no cost. The turnaround time for labs nationally, as you probably know, can be anywhere from 5 to 7 days. Our labs probably is something similar. In the meantime, it doesn't change what you do. Anyone who believes they have symptoms should self-isolate. That means 7 days or more, you need to stay away from others. So it doesn't change necessarily, but what you will know is, did you have it? And if you didn't, then maybe you can get on with your life a little bit quicker.
And can you walk us through the process of people driving by, like, where do I enter?
Yeah.
Just in layman's terms, the whole
Sure.
process.
So what's great is you drive up, and each site is laid out similarly. You drive up, and then there's an assessment tent up at the very entrance of each site. At that point, you'll get a series of questions asked of you. If you have the criteria of the series of questions, then you'll get a more detailed medical assessment by a medical professional. That medical assessment happens, again, at the same site. So we're able to do the initial screening questions, and if indicated, the further assessment there. If based on that assessment, a test is warranted, then you come into our system. If it backs up a little bit, then you'll be queued to one of 3 tents. You'll go into the tent, you'll get the test. They've been telling me that it takes maybe, I don't know, let's say 5 minutes a person to get a test, and then you'll be on your way. Obviously, if you're very sick and you need to not come here, go to a hospital. I mean, this is just an assessment center, but that's generally the queue of how it goes.
How many tests can you do a day?
We can do hundreds. I mean, we have capability to do hundreds. We'll do what is needed. Our hours of operation from 9 to 3. We're going to use protocol that is appropriate and medically indicated, and that's kind of it. So I'll step back and see if.
You have 2 currently open, a third, I guess, a day on the process.
Well, I think the correct answer there would be right now we felt as if the centers that we do have is appropriate, but as more resources come in, then we'll open more centers to be able to supply and demand. Right now, as you know, this is a global situation, and getting the resources as far as testing equipment and all of this is something that we have to try to obtain the best that we can. A lot of that is out of our hand. Again, it's not for lack of effort, but we're going to do whatever it takes to be able to make sure that Davidson County is taken care of.
Some of our viewers feel we should go on a statewide lockdown. Do you think we're heading in that direction?
Well, I can only say that as far as what Mayor Cooper has done, issuing this Safer at Home, it's been something that's been very great. We can see with that, at least if you look around, you see that our numbers are very low actually coming to assessment center. I think in some small way, that's really played a big part with it. So for now, stay at home, that's the safest place to be. And if that needs to come about later, then again, that'll be called by the governor. But I'm just appreciative of Mayor Cooper's taking the lead as far as Tennessee and issuing the Safer at Home.
Can you come here if you don't live in Davidson County?
Well, and that's a good question. And I think Dr. Jahangir had said this earlier. This is basically set up for Davidson County. And of course, this is for our residents here. But if someone else showed up here, I mean, we're going to be and treat everybody human, right, and decent in this time. But this is for Davidson County. That's how I'll answer that. Thank you.
Great question. So the question is, how are we able to pull this off at zero cost to people? Several things. First of all, Dr. Webb's here as a National General. Our hospital systems have from day one stepped up. So all the medical staff, all the medical information, protocols, coming from hours and hours and hours of work. We've been meeting to set these up for a long time. And so I think as one of our partners, Dr. Webb, National General, Jeff Balzer and Wright Pinto Vanderbilt University Medical Center, they've committed to these sites. Heather Ohan and Tim Adams with their other systems, as well as Dr. Hildreth. Huge, amazing partners. So that's one for medical personnel. All the stuff you see are Metro resources. The mayor authorized these tents aren't given to us for free. These trailers aren't given to us. The security isn't free. Mayor Cooper understands the importance of this and authorized the expenditure of capital there. And then the volunteers, all these staff. We have, I think, around 20 volunteers, some non-medical personnel. These are all volunteer. Hands on Nashville. We have several churches that have agreed to volunteer. We're going to use volunteers for our results line. So when you get your assessment, you'll get a paper that here's how you get your test results. I mean, that's a results line. Our hotline assessment center is something that Dr. Caldwell set up with his team at Lentz at the public health department. That's 15 medically trained individuals who are we went there this yesterday, the three of us, and they're volunteering their time, and so it's a lot of resources that come together. But at the end of the day, and then final part of that is testing, the actual test kit and the test results. The state of Tennessee agreed to pay for those for our residents.
Dr. I would like to add this real quick because this is important. I think, from the Office of Emergency Management standpoint, one advantage that we did have, of course, we just came through this tornado, right, and still dealing with that. So we already had a great relationship with TEMA. When we start looking at Officer or Director Sheehan, his group at TEMA, and then we had FEMA in here already dealing with, again, with the tornadoes. So at the Office of Emergency Management, we had all those resources already here. So when COVID-19 actually struck us and hit us, we were able to go ahead and use those resources, as Dr. Jahangir had said. But one thing about Tennessee, and I think this is not just true about Tennessee, but I'm just proud of that, is that when the call is actually given, people really do want to come out and help. Our resources that we use right now that was available to us during the tornado, it just extended to COVID-19, along with Hands on Nashville, and other people that really want to come out and give a hand. We just so deeply appreciate that. So again, sadly but true, when trauma or something like this hits, people do come together for the greater good. So we can't say enough about our volunteers. So I just want to say thank you for everybody that's willing to come out and help us out in this situation. You want to say something?
I would probably want to add one thing.
Yeah.
Just following up on the Chief's remarks, the Tennessee State Department of Health has a medical reserve corps, and we also have a unit here in Nashville-Davidson County. We'll put out that website and contact information, so if you are a medical professional, you're looking for a way to volunteer, in addition to Hands-On Nashville, can communicate what your skills are there. But there is something specifically called the Medical Reserve Corps. It's a national program. The Tennessee State Department of Health has a way to sign on there, and they're going to be helping us manage medical professionals all across Tennessee to distribute them who want to volunteer to those parts of Tennessee that need it most. So thank you.
Good morning. Just want to say thank you to the mayor for his commitment to this effort. Today is Doctors Day as well. We have a couple of doctors here on the panel and all of those across the city that are helping with this effort. Just want to say happy Doctors Day. And certainly to the community as well as our staff there at the hospital, Nashville General. We're the city's hospital. This is an opportunity for us to step up and be a part of the solution. This pandemic is something that's causing concern across the country. But I think we're doing a great job here, and people are coming out. You see all of the support here and the very knowledgeable individuals that are involved. So we just want to make sure that this continues until we can bring this under control. But Nashville General stands ready to continue to step up and be a part of the solution. Thank you all.
All right, this concludes our question and answer session. We will allow you guys about 10 minutes to get some B-roll, some different footage that you might want to get, and then we're going to resecure the area for those needing to come in and get tested at this assessment site. Thank you.
Thank you, guys.
Thank you all so much. Really appreciate all of you. Ditto.
Right.
I mean,
We're real people.
Second best conference I've ever known in my life, where there's actually like cameras.